And a very warm welcome to you all here today to our podcast. This podcast is based around, it's an EU Interreg funded programme for Northern and Periphery and Arctic countries. And this podcast is going to be about what we call the SelfCare Project. And it's about working with rural communities on self-care and innovative solutions to try and help them with health care. And part of this podcast is about, we did a scoping review of the literature to try and help the project. And we're going to go into a little bit more detail during the next minutes about this scoping review. So first off, I'd like to introduce everyone around the table at the podcast. If you would, give a brief introduction of yourself and your role. Peter Hayes is my name. I'll be doing some of the interviewing and some of the contribution. I'm an academic general practitioner here on the west coast of Ireland. And I'll allow our next roundtable participant on my left to introduce themselves.
Thank you, Peter. My name is Liam Glynn. I'm a rural GP for the last 25 years in a small village on the west coast of Ireland, Ballyvaughan, County Clare. And I also hold the chair of general practice at the University of Limerick, and I'm principal investigator on the SelfCare Project.
Brilliant. Thanks, Liam. And to my right, Irina, I'll allow you to introduce yourself.
Thank you, Peter. My name is Irina Mamai, and I'm myself from Ukraine, so this project means a lot to me. So I'm a doctor and researcher in the UL working with SelfCare Project within SelfCare Project.
That's brilliant. Thanks, Irina. And just to note, we're here seated in the University of Limerick where our podcast is taking place today. And just to give some context, within the Irish setting, one of the groups we are working with based in rural Ireland are a displaced Ukrainian population. But Liam and Irina, could I ask you, can you talk to me a little bit about the experience of working as a GP with folk from Ukraine now living in Ireland? Can you tell me a little bit about that?
Well, I suppose in many ways, the arrival of our Ukrainian people to the village of Ballyvaughan, where I work, it happened very quickly and very suddenly after the outbreak of the war. Irina herself was in one of the first groups to come to the village, and over the course of the conflict, the village, with a census population of just over 250 people, has accepted at various times over 500 different Ukrainian refugees into the community. And I think that integration and acceptance, and I suppose the motivation of the community to try and be as helpful as possible in all sorts of different ways, I think that has been a really good example of how this type of thing can work. In fairness, there's been a significant amount of government support as well in terms of, for example, delivering healthcare services. So really importantly for us, Dr. Irina and her colleague, Dr. Vika, who are obviously themselves coming from Ukraine, have been really essential as a part of our team in delivering those healthcare services. But I suppose early on in the journey, we realised there was a lot of healthcare need out there, number one. And number two, there was also issues like things like trust, which were really important to try and manage in order that people were getting timely access to healthcare. But really, the best person to talk about this is Irina herself.
Yeah, Irina, could I ask you about your experiences and maybe to some of the listeners to let them in on what it was like arriving in Ballyvaughan and your role in providing healthcare to your own community?
So it's been a while. It's almost 4 years since I arrived to Ireland, and it was confusing over the first few months, not only for me, but for many Ukrainians. And even now, I see Ukrainians who arrive in Ireland and are confused.
Yes.
But over the time, I would say we've built this trust, and now our patients travel long distances from all over Ireland to see us because of the connection we've made with them.
That's a phenomenon within itself. And I know initially, Irina, you worked in medical services with translation and help with patient management, and now you're working formally as a GP as well within the practice. So that's really great to hear. So the essence of today is to discuss the scoping review about how, I suppose the initial idea is why we did it. So Irina or Liam, I'll add a little bit to it because I understand the context of it. Maybe initially the idea of doing a scoping review was to look at interventions that were occurring around the world with rural populations and displaced and vulnerable populations, and how you could improve self-care within those communities, innovative solutions, mind, involving technology, and how we could improve healthcare for folk. And we wanted to examine the worldwide literature to make sure that our partners in this project, who we will go to in a moment, and ourselves, were not duplicating any work or doing projects that have already been done. That was the first reason to examine the scoping review. And I think the second reason was to give us some lessons that have been learned, what worked, what didn't work, what were the key themes, etc. So a really interesting project to do this scoping review, and fully supported by our partners. And maybe we should introduce them. They're not in the room here, but a key element to this pan-national self-care project are our partners. And Liam Marini, you might let us know who our partners within this project are.
Well, we're working closely with a team from Iceland. And in Iceland, the community that's been, I suppose, that subject or part of the project is the scattered archipelago island communities, a lot of them quite elderly populations, who there's real challenges in delivering timely healthcare access to these populations. And so I suppose that was the thing that really united the different groups involved in the project. And then our lead partner, obviously, which is based in Sweden, and the group that's being examined as part of the project is the migratory Sami reindeer herdsmen, who again, because of the fact that they migrate and move with their reindeer herds, often they'll move across country boundaries or across region boundaries as they move with the reindeer, which makes it difficult for them then to access healthcare in a timely fashion and also manage their own health in an effective way. So in many ways, they were the three different populations, and obviously Ireland, Iceland and Sweden then were the three different teams and countries involved. And I think what we found very quickly was that a lot of the challenges were actually, even though these are very different populations, a lot of the challenges were very similar around trying to develop something that's culturally appropriate to the different contexts, and also that was built around the concepts of trust, but also around potentially using digital innovation and the potential that holds to try and make healthcare more accessible and make these populations more connected to the healthcare system wherever they were.
Excellent. Thank you, Liam. Irina, now could I ask you about the scoping review? How did we do it? How do you do, just in maybe broad terms and briefly, how did you go around doing a scoping review?
So initially it was a challenge because of the different populations and different views, but eventually it turned out we really are seeking for the same solution, something to improve self-management in rural or remote areas for people, for different people. So we've searched through several databases like PubMed, Embase, Web of Science, Google Scholar and Grey Literature. We've found more than 1,000 articles.
1,000 articles?
Yes, and we've analyzed it with a group of researchers within our project.
And can you name who was involved with the actual process? Because I presume that you did your searches and then these 1,000 papers went into a database. Did you use a database, and then who reviewed these papers to see if they're relevant?
So myself, and we have this Ivy student. So it is an initiative co-funded by EU Interreg.
Great.
Who really helped with this. So we've worked in Rayan software, where we looked through the articles and abstracts, just the simple part, through all these 1,000 articles, which gave us a lot of lessons of what we are looking for and what we are doing. So
because the key points again, and we've kind of stressed this, it was about self-care, and Liam, you've mentioned it again, culturally appropriate interventions. Really important that these aren't any interventions. So I'd imagine within the search you had to get that word culturally appropriate in, which made it more difficult. And obviously started off with 1,000 articles, and you narrowed this down over time, looking at abstracts and different things. How many articles did you have to get the whole paper for and maybe do an in-depth review of?
So we ended up with 43 articles.
Right.
Most of which were about refugees and older adults and indigenous populations. But many of them were about different communities in like, there is a list of countries.
Correct.
But we found out some
interesting lessons, no doubt.
Yes.
Yeah, so and that's where you're heading towards, is the results themselves. So were there some themes that came out? Were there some lessons that we could learn, or what did you come across? Or you might be the interest, because I know you were leading this, and Liam, you were very much involved as well in the generation of these themes. So maybe I might ask both of you to talk a little bit about the results, or what are things that we can use in making our interventions. Our three partners from Iceland, from Sweden, and here in Ireland, who are now going to design culturally appropriate self-care innovations or interventions for these communities we've spoken about. What lessons can we take going forward?
Well, I think there was some really interesting themes that came out of the data, Peter. There was 5 cross-cutting themes that became very clear to us when we examined those papers in detail. The first of those was language and communication.
Okay.
And we were able to demonstrate from the papers we looked at that programs that use participants' first language through bilingual staff, our interpreters, our culturally adapted materials, consistently show better engagement and understanding from populations in terms of healthcare access.
That's really good, Liam. So we're talking about first language use, really important theme. And Irina, you might talk a little bit about, because I can see that, culture is a real important concept that keeps coming up, about trust and cultural safety was a second theme. Could you talk a little bit about that?
So yes, we've seen that interventions work best when they were delivered by people from the community or by bicultural or peer workers, and that's actually what we are seeing every day in our practice.
Correct.
I started as an interpreter, and that really helped build the trust between the staff of Podvahan Medical Center and the Ukrainian community in the village.
Yeah, and like, I suppose the format of the intervention is one thing, but trust, is that a key factor that keeps coming up all the time when people are engaging with healthcare? Would that be a fair comment?
I think that's very true to say, Peter. And increasingly nowadays, trust is a major issue, particularly when we talk about digital interventions, and there's so much difficulty around, online and knowing a trusted source for information first of all, but also for contact, giving over personal details. So it came through in lots of different aspects of the data that emerged. And I suppose at the same time, we got to recognise that there's real potential in digital solutions when you're talking about hard to reach populations. So another really significant theme that came through was this idea of how in rural and remote settings combining digital tools with human support, which can really promote the trust element, was key to overcoming distance and healthcare access barriers.
So that's that combination about, okay, yes, we have face-to-face. Sometimes over geography this can be challenging, but we need to figure ways of how we can deliver this in an innovative fashion using the technology we have. Really, really important. Yes, Irina, I just wanted to ask you next, because you're part of the Ukrainian community in the west of Ireland, how important a theme was community or peer involvement, or how important was that within what we found in the scoping review for communities to get involved?
So the scoping review showed that it is really important to engage people so they feel that they are empowered.
Yes.
And we see it in the project because, we are trying to invite our Ukrainian patients and our Ukrainian friends into this project. So we've actually had a co-creation workshop with Ukrainian participants where they actively shape how digital tools are adapted and what information is useful and what feels safe and accessible.
Brilliant, because that's a key thing, again, a key theme, co-creation. So the old saying, nothing about us without us. And that's a very, very safe mantra to live by, and came out very strongly as a theme within the scoping review. Just on the fifth and final point, I notice here that mental health has been a real important and strong theme that has come across, particularly for displaced communities, but also rural and isolated communities. Would you talk a little bit about that, or about how we need to be very cognizant within this project, our three partners, that mental health is an important concept for folk? Could you talk a little bit about that?
So it's obvious that for refugees, mental health mental health help is quite an issue. Because of the circumstances they find themselves in the new life, which may be confusing.
And stress.
And sometimes very disorientating, I think, as well. And of course, when you arrive in an entirely new environment where you don't speak the same language, and it's been a really, so I suppose, traumatic experience even getting there. Then finding a community and a situation in which you can even be met by someone who speaks your own language. We found that certainly just in practically delivering healthcare services to our refugee population. This was the probably most important intervention of all, was just having somebody at the door who welcomed you in your native language. Even that in and of itself, I think, can make a really dramatic difference to a lot of the mental health morbidity that travels with people who have been displaced.
Yeah, and so our 5 cross-cutting themes we've come across are, and I'm going to paraphrase slightly: first language involvement, really important; trust, cultural safety and cultural appropriateness; engagement of the community themselves; don't forget mental health; and hybrid deliveries are good. Technology works, it helps. So these are the 5 themes I think that came across from the scoping review. So the key question is, where do we go from here? What are our next steps?
Well, I think it's a really exciting time for the project, because now that we have that information, and it allows us to look at what have been the really important and high quality solutions that have been developed around the world, we can take that knowledge, and we have already done that, as Irina mentioned, in the co-creation workshop, and I guess meet the community face to face, and sit down and co-design a digital intervention that ideally will help improve healthcare access and self-care and self-management for the population under study. And in this case, it's populations under study, i.e. our Ukrainian refugee population in Ireland, our older adults living on island communities in Iceland archipelagos, and also our Sami migrating reindeer herdsmen, all of whom have common but also different contextual challenges.
Yes, and I think the co-creation workshop, which we have occurred, we're in the process of analysis, and we will have another podcast about that, no doubt in time. So, Irina, final word to you about the process. So, as Liam said, we're co-creating. We're going to develop an intervention. What would you like to see come out of the process, I suppose?
So we're planning to help our Ukrainian patients in using the HSE Health app. We're hoping to adapt this app to different needs of different populations, so eventually everybody will benefit from it.
Yeah, fantastic. That's where we're going, and we hope to be able to report back to you shortly in a further podcast about that, and we hope you're able to adapt the lessons that we've certainly found from this scoping review. And thanks for your time, and thanks for listening and joining us. Take care.